Incontinence. Now, we're going to focus mostly on the female patient because when we see patients for this particular condition, it's usually female patients. All right, so first of all, let's talk about two very common types. We have urge incontinence and stress incontinence. So let's define those a little bit here. So urge incontinence is that sudden, intense, involuntary, and that's important, involuntary urge to go to the bathroom. All right, when this hits, you better be close by because you're not going to have any control of when you go to the bathroom. So that's a biggie. And let's face it, these are very, very embarrassing for people. All right, next would be stress incontinence. This is when a pressure is exerted on the bladder and that bladder is weakened over continued actions that weaken the bladder muscle. In this particular case, you can do some things to prevent that, and we'll talk about that later. But these are the two that are primary for us. Something else we need to talk about, if you suffer from regular urinary incontinence, there might be an underlying problem. And what we want to stress is you get to a doctor if this is a common occurrence for you, because you might very well have something that's weakened the pelvic muscle as a result of, say, a urinary tract infection or some type of hereditary problem. Get to the doctor, get to the bottom of it. Okay, so what can we do to prevent these things? Let's avoid some of those stressing. So when you cough, when you're putting extra strains on the muscle in that area, you're also applying pressure to the bladder. All right, so one of the things we try and tell our patients is stop doing the things that are going to stress the bladder out. And we'll get into a little bit more of that, like these irritants on the bottom. The other thing is you can also complete the Kegel exercises that your doctor might provide for you as a prescription for your preventive medicine for this. And those are just floor exercises you do at home. They're pretty simple. All right, those will help strengthen your muscle in that lower abdominal area to help contain that, the pressure or all of a sudden the sudden urge to go to the bathroom. All right. So the other thing you could do is go see your doctor about Botox injections. These also help to tighten up the bladder muscle itself. Okay, so what do you want to avoid? Let's go back to common irritants. These are diuretics that often cause you to bring more volume into the bladder itself. These common irritants, these are food and activities that might be in your life. Alcohol, of course, and along with alcohol could be a carbonated beverage. All of these are an irritant. Caffeine is an irritant. Smoking, think about smoking. You are going to have problems with coughing, clearing your throat in the morning. All of that puts pressure on the bladder. Plus, the bladder gets weakened by the toxins that build up in it as a result of smoking. All right, the other thing is artificial sweeteners, chocolate, chili peppers, high spice, sugar, acid type foods. Lastly, but not least, but certain meds like blood pressure medications and sedatives can also cause you to go to the bathroom more often. Why do you want to put yourself through that? All right, got a question? Go see your urologist. He'll help you out.